It is my pleasure to be able to share with you my intervention presentation and capstone video reflection for Capella University NURS4900 Capstone Project for Nursing. My name is Amanda Dry. I am a registered nurse, and it is my intent that this video will provide insight into my journey to become a baccalaureate prepared nurse. For my capstone project, I have proposed a diabetic self-management intervention. It is important as a baccalaureate prepared nurse to have a stronger understanding of this condition so that we may feel more confident in our nursing practice and provide better quality of care for our patients. The goal is to equip patients with the resources, services, and education that they need to successfully navigate their health. The patient that I have been assessing during this capstone course is a 53-year-old woman living with type 2 diabetes. For her privacy, I will only refer to her as Mrs. H. I met Mrs. H as a member of the community seeking assistance for her diabetes in an online social media group. I introduced myself, I explained my credentials, and that I was a student, and my intent was to help her find solutions for her diabetic management and also strengthen my patient care techniques as a baccalaureate prepared nurse. Since we are still in the midst of the pandemic, our communications were online between meeting with her and also meeting with family members to address diabetic education. I spent a total of 9 practicum hours. For Mrs. H in particular, I isolated 3 primary concerns. The first was her insurance plan had a $10,000 deductible, which meant that paying for diabetic management was largely out of pocket. It made access to specialists difficult and in her case non-existent. The second issue, she's on 2 current medications, metformin and also glipizide. Currently they're ineffective at controlling her daily blood glucose levels as well as her hemoglobin A1C levels. She would like to try a new prescription, Rybelsus, I believe, but she can't afford it due to the patient cost out of pocket. It would be $800 to $1,000 a month. The third major concern is a lack of support and diabetic education from her primary care provider. She says she likes them, they're nice, it's just not meeting her needs. So with this information in mind, I came up with 3 primary interventions as a solution. So one was to provide Mrs. H with necessary education of the disease process to better implement management strategies. When you understand better, it's easier to follow along with the care. The second was to encourage Mrs. H to maintain a health routine, go to her visits to promote wellness and avoid complications or other preventable emergency room visits and hospital admissions. In particular, she can go to her primary care provider and check upon her A1C levels. And then the third intervention would be to encourage physical activity and a more healthful, nutritious diet into the patient's lifestyle to promote a healthful weight. She does work out right now, but there was a major concern for her nutrition. I created a PowerPoint with speaker notes and a voiceover presentation and was able to share it with the patient, as well as several of my family members who would also benefit from diabetic education. The PowerPoint presentation lasted about 10 minutes. In hindsight, I think it lasted a little too long because I could notice people becoming distracted and losing their focus, myself included, even when I would watch it back. While working with the patient during previous encounters, we had already discussed portions of this information as it went along with the research and while assessing her. So this information might have been redundant to her. However, I'm not upset about this because her concerns were addressed during our conversations together. And personally, I prefer this conversation approach. It just feels more natural. The feedback I received was that the PowerPoint was visually pleasing, it was error-free. My audience members were each able to tell me things that they learned from the presentation. Mrs. H was previously unfamiliar with MyPlate, and she agrees that this is a simple enough plan to make her nutrition goals more manageable. My husband actually enjoyed the My Plate method as well, as he was previously unfamiliar with this government resource. I provided them both with the website for myplate.gov. She also was previously unfamiliar with how much GoodRx programs could benefit her when paying for her prescriptions. Another takeaway from those who saw my presentation was the benefit of utilizing SMART goals. So SMART is an acronym for S, specific, M, measurable, A, attainable, R, realistic, and T, time-based. It's from the Center of Disease Control and Prevention. There was no date. An example of a SMART goal might be, I will add 4 servings of fruits and vegetables to my diet every day for the next week. So to achieve this goal, the patient can sit down, they can meal plan for the week, they can make a grocery list to set themselves up for success. By starting only 1 week, this goal is much more attainable than I'm going to do this every day from now on. And it's more specific than I'll eat healthier. You know, with these SMART goals, they can make the latter possible. Teaching SMART goals can help healthcare providers improve the health and safety of the community. Now, my patient and family were also unfamiliar with the CDC recommendations to exercise 150 minutes per week. This is from the CDC 2021. Everyone knew and understood that exercise is beneficial to their health, but they were unfamiliar with the evidence-based research behind the details. And I believe the same goes for the health complications associated with type 2 diabetes as well. Everyone knows diabetes is bad for your health, but they were unaware of the why or the statistics and the potential complications, such as the National Diabetes Statistic reports from the CDC indicates that as of 2017, diabetes is the 7th leading cause of death in the United States, with more than 34 million diagnosed as diabetic. This is from the CDC 2020. Learning to prevent and manage diabetes requires lifestyle changes that can prevent complications. These complications might be hyperglycemia, hypoglycemia, kidney damage, coronary artery disease, vision loss, neuropathy in limbs, amputations. They're at an increased risk for strokes, even death. Now, after this presentation, I do truly feel like the education and resources provided in my intervention presentation will be able to help patients learn to better manage their diabetes and understand the importance of the lifestyle changes that they're being asked to make. I also realize that we can't make our patients change, but I do believe that I've added value with credible evidence into why they should make these life-altering adjustments. To research and implement my Capstone project, I first vetted this credible information. It's important to use credible and relevant sources of information when researching a topic. When possible, I prefer to use mainly peer-reviewed articles due to their rigorous standards to become published. The articles are evaluated by experts in the subject, such as faculty members, peers, or field researchers. The article provides the author's name, their credentials, so that you can verify them. Before approval for publication, the content is evaluated based on the method of research, the results that the research yield, and also the literature. If deemed substandard, the journal will not be published. Furthermore, I select info relevant to a given topic, in this case type 2 diabetes, using keywords and adjusting timeframes for the research to be within the last 5 years to ensure currency. I review the abstract and also the conclusion to determine that the articles were specific and relevant to diabetes. To best gather research, nurses should have a credible set of guidelines that they follow to determine credible sources. One method is the CRAP test, which evaluates for currency, relevance, authority, accuracy, and purpose. This is according to Benedictine University 2021. Identified for you are 5 sources deemed credible by the CRAP test. just as an example. So these sources provide credible information regarding my research on type 2 diabetes. These sources could include the American Diabetes Association journal publication Diabetes Care, which regularly updates current best practice standards for medical care in diabetes. The U.S. National Library of Medicine and National Institute of Health's database PubMed Central. It has over 2 million articles archived. There's the SINAHL. This is the cumulative index to nursing and allied health literature. This is from EBSCO Publishing, which is a database for peer-reviewed articles. The Center for Disease Control and Prevention's National Diabetes Statistic Report. So this is the most recent update, the National Diabetes Statistic Report of 2020, estimates of diabetes and its burden in the United States. Also, there is the website for the Association of Diabetes Care and Education Specialists, ADCES. These sources have been ranked in order using the CRAP method criteria. So with this method, I was able to research diabetic meal planning, exercise guidelines, community resources, and government and organizational initiatives such as the Healthy People 2020 also, but 2030 diabetic objectives. Now, the Healthy People 2030 is an important policy affecting care of all patients, including diabetics. The Office of Disease Prevention and Health Promotion's Healthy People 2030 initiative established the goal to reduce the burden of diabetes and improve quality of life for all who have or are at risk for diabetes. This has no date. It's from the Department of Health and Human Services. So to make possible this goal, Healthy People 2030 further identifies 5 objectives for diabetic wellness planning. The first is to reduce the number of diabetes cases diagnosed yearly. The second is to increase the proportion of adults with diabetes who have a yearly eye exam. The third is to reduce the rate of death from any cause of diabetes, in patients with diabetes. The fourth is increase the proportion of people with diabetes who get formal diabetes education, as I'm hoping to do. And number 5 is to increase the proportion of adults with diabetes using insulin who monitor their blood sugar daily. My patient in particular did not use insulin, but they do daily finger sticks. These objectives in particular have helped shape my Capstone project. As a baccalaureate prepared nurse, it's important to familiarize ourselves with the Healthy People 2030 initiatives to strengthen our nursing practice and better arm our patients. You know, it's imperative that we're educating patients on proper prevention and management strategies, and then coordinating appropriate health care to ensure wellness promotion. By following these objectives, we can better equip our patients for managing their diabetes and align our care delivery with their healthcare needs to improve quality of life. It's also important to acknowledge the importance of healthcare technologies. One of the impacts of technology in nursing informatics is the enhancement in patient care delivery. For example, by implementing and teaching patients access to their own medical charts, we can vastly improve patient autonomy and involvement in their health. Dendre et al. 2019. Involving patients in their own care yields better patient health outcomes. Technology has made tremendous achievements in improving patient care coordination, as well as access to community resources. You know, having a strong support system is necessary for diabetic management, and technology helps facilitate that need. Patients can meet with other diabetics in chat rooms, in video calls, social media groups. It is in such groups that I actually met the patient and I learned that they needed assistance. Due to technology, I was able to communicate, assess, and provide solutions for the patient, the same way that patients are able to have telehealth visits with their care providers. Furthermore, technology is one of the only ways that Mrs. H is effectively managing her diabetes at the moment, beyond taking her medications. I assessed her to see what technology she currently uses for her diabetes. Her two primary methods of technology are her right test blood glucose monitoring system. It's a diabetic home glucose meter, and an app associated with this device called Right Test Care. So the meter allows her to assess her blood glucose levels at home by reading the results of her finger sticks. Then the meter synthesizes with the app and uploads her glucose levels to be tracked. The app allows Mrs. H to know when her blood sugar is too high or too low with simple color-coded numbers. So red is high, yellow is low, and green is ideal, I believe. She can add notes, she can add photos in the app, she can set targets, she can see trends in her blood glucose levels. The app can send reminders for her to check her blood sugar with meals or at bedtime. The results from the blood glucose monitor are then synced with Bluetooth technology onto the phone. And I was able to find detailed features on bionomyusa.com website. I believe I'm saying that right. They are the creator of the Right Test services. Their website was updated 2022. The app is free with the glucose monitor, which is paid for by Mrs. H with no help from her insurance, as she has not met that $10,000 deductible. Also, she would prefer to have a continuous glucose monitoring device, but because of that deductible, she can't due to the added expense. There are a wide range of benefits patients and nurses can acquire from fully engaging in healthcare technologies that are available. I believe the outcomes of this Capstone project have matched my initial predictions. I provided clear, thorough, and detailed information to help the patient succeed in effectively managing their diabetes and their overall health. The information was presented and kept simple and direct. The interventions proposed are manageable, they're attainable. But the biggest lesson for nurses, and even an important life lesson, you can't want something for someone more than they want it for themselves. As documented in the core ELMs, I have spent time educating the patients and ensuring they have a better understanding and a clear plan for improving their health. I've attempted to establish trust and rapport and respect, to deem credible and reliable so that the patient feels comfortable addressing their struggles with me. And from now, this point forward, it will be up to the patient to implement those changes that we've talked about so that they can manage their diabetes successfully. For Mrs. H, we can see if this is proved successful by reassessing her A1C levels in 3 months. It's going to be a quality indicator to measure if she's been able to implement these teachings from the Capstone Project intervention. Personally, I can see and feel the personal and professional growth that I've made throughout the Capstone Project, as well as the RN to BSN program in a whole. I have the ability to communicate much more effectively. I've seen an improvement both written and orally. I've gained confidence in both audio and visual presentations that I was lacking before. In my nursing practice at the hospital, I notice I'm getting more confident with my patient care, my patient education. This program has challenged me and it's improved my ability to think critically. I'm now much more comfortable finding credible evidence-based research to guide my nursing practice. I've noticed an improvement in my time management skills, especially balancing work full-time as a new graduate nurse and actively continuing my education for this higher degree. As a whole, I take pride in myself and my achievements, and this program has allowed me to challenge myself in a great deal of ways. So now, I guess the $1,000,000 question is, what's next? Thank you for the experience. Thank you for listening.